Almost 40% of adults wake up at night to urinate. In about half of them, it's benign. But in the other half, it can indicate a disease. That's why we will talk about the top 7 causes of nighttime urination. Generally, urinating once per night is considered less harmful. And in many cases, it is normal, especially in older adults. But in younger people, even urinating once requires attention. If a person urinates more than 2 times per night, in almost 80% of cases, this shows an underlying disease. One nighttime urination in younger adults under 45 years old is usually due to lifestyle or evening fluid intake like caffeine, alcohol, or water close to bedtime. This is most common in students, young workers, and people who drink coffee, energy drinks, or alcohol in the evening. In older adults, the most common cause is benign prostatic hyperplasia in men, responsible for almost 60% of nocturia cases in older men. This is most common in men over 50 to 60 years, especially those with enlarged prostate symptoms. In women, the most common cause is overreactive bladder. When there are postmenopausal bladder changes plus estrogen loss, it is responsible for almost 50% of nocturia cases in older women. This is most common in women after menopause, especially those with urinary urgency and frequent urination during the day. The signs of benign prostatic hyperplasia in men are frequent urination day and night, weak urine stream, difficulty starting urination, dribbling after urination, and feeling of incomplete emptying of the bladder. If these symptoms last more than 3 months, there is a high probability of prostatic hyperplasia. Digital rectal examination is used to feel prostate size and texture, and PSA test is used to rule out prostate cancer. In women, in case of overreactive bladder, symptoms are sudden strong need to urinate and frequent urination more than 8 times in 24 hours. Sometimes there is urgency incontinence, leakage before reaching the toilet. Symptoms should last more than 3 months, and urgency is a mandatory symptom. No clear cause should be present like infection, stone, or cancer. The main reasons are nerve signals from the bladder to the brain are too strong or uncontrolled. Loss of inhibition from the brain, common after menopause or with aging. And estrogen loss are important, make bladder lining and nerves more sensitive. Another common cause of nighttime urination is heart failure, especially in older adults. It's responsible for about 25% of nocturia cases in elderly patients. Signs are leg swelling during the day, shortness of breath, and waking at night to urinate more than twice. This happens because when person lies down, fluid from the legs return to the circulation. The heart cannot handle the volume, and the body removes it, making more urine. The mechanism is the release of atrial natriuretic peptide, ANP, which increases salt and water loss at night. Common hallmarks of heart failure is history of leg swelling and shortness of breath. Echocardiography is used to confirm heart failure. This is most common in elderly patients with chronic heart disease, especially those with edema and breathlessness at night. Another frequent cause is chronic kidney disease, CKD. This is responsible for about 20% of nocturia cases in older adults. Signs are urinating at night, fatigue, and sometimes swelling of the leg or face. The mechanism is loss of kidney concentrating ability. So the urine stays dilute and is produced at night as well as during the day. Best practice to diagnose this condition is blood test for creatinine and estimated glomerular filtration rate. Urine tests for proteins, blood, and electrolytes are also important, and ultrasound of kidneys is used if needed. This is most common in older adults with long-standing hypertension or diabetes. The third most common cause is diabetes mellitus. In young and middle-aged adults, it's an important cause. It's responsible around 15% of nocturia cases in adults. Signs are frequent urination day and night, increased thirst, and sometimes weight loss. The mechanism is glucose in the urine pulling water with it, osmotic diuresis. Best practice to diagnose diabetes is fasting blood glucose level and glycated hemoglobin tests. Urine test shows glucose in the urine. This is most common in younger and middle-aged adults with new or uncontrolled diabetes. The fourth most common cause is sleep apnea. A hidden but frequent cause is obstructive sleep apnea. It is responsible around 10% of nocturia cases in middle-aged and older adults. Signs are loud snoring, daytime sleepiness, and frequent nighttime urination. The mechanism is repeated oxygen drops during sleep, which make the heart release ANP, increasing urine output at night. Best practice to diagnose sleep apnea is history of snoring and daytime fatigue. Polysomnography sleep study is the gold standard. This is more common in overweight middle-aged men and in elderly patients with snoring and tiredness during the day. The fifth common cause is urinary tract infection, UTI, especially in younger women. It's responsible around 15% of nocturia cases in young adults. Signs are burning with urination, urgency, frequency, and sometimes blood in the urine. The mechanism is inflammation of the bladder wall, which reduces bladder capacity and causes the urge to urinate day and night. Best practice to diagnose is urine dipstick for nitrates and leukocytes and urine culture if needed. This is most common in young women, especially after sexual activity and with poor hydration. Another common cause is medications, especially diuretics, especially if taken in evening. They are responsible for about 10% of nocturia cases overall. Signs are frequent urination starting soon after the pill and continuing at night. The mechanism is direct, increasing sodium and water loss by kidneys. History of medication intake is important. And in many cases, adjusting diuretic timing to the morning often solves the problem. This is the most common in people with high blood pressure or heart failure who use diuretic therapy in the evening.